Good morning, everyone, and welcome to the IOM workshop on pandemic financing. My name is Prashant Yadav. I'm at the University of Michigan. Before we start, I want to thank the members of the planning committee which helped put this workshop together. Elizabeth Emanuel, Gabrielle Fitzgerald, Olga Jones, Nachikete Moore, Francis Reed, and Peter Sand, some of whom are here, some weren't able to make it. I also want to thank the Board on Global Health at the Institute of Medicine, Patrick Kelly and his colleagues, Jillian Buckley, Rachel Pitlick, David Garrison, who've put a lot of time and effort into planning this workshop. Also, many panelists who've agreed to take our time and come here and share their insights. Also, many people who the planning committee or the IOM staff consulted with to get their thoughts and insights while planning this workshop. This workshop is a part of the Global Health Risk Framework, which IOM National Academy of Medicine President Victor Zhao will tell us more about. It has 4 work streams, and financing is one of them. Victor will also tell us more about what the other work streams are and how this workshop fits in with the broader framework and the components of it. I want to highlight that this is an information gathering workshop, which means the intent here is to learn about different options and mechanisms and understand the pros and cons of those, not necessarily to make recommendations or make choices, which is something that the Global Health Risk Commission will do. So this is, once again, an information gathering workshop. We will discuss a variety of issues. We'll think about the pros and cons of each and leave it at that point. The other part which is important to think about is the design of the workshop has been made to be very interactive. So there are multiple panels, and each panel has 4 or 5 panelists. There are going to be very few presentations and speeches. It's going to be mostly very crisp remarks. Questions to the panelists have been prepared, and they will have the responses. There will be a time for Q&A for members in the room, but also I'm told there is an overflow room, so in case there are people in the overflow room and they have a question, we'll make sure that we bring that question here. Then I think going to what this workshop will address, the Ebola crisis highlighted the need for having both a larger quantum of money for public health preparedness and also having the money available at the right time. So those are 2 important themes that we'll address in this workshop. It's organized around 4 key sessions. One looks at the different options for making funding available, including private sector models and innovative financing. Another session looks at what are the triggers for payouts. Many of the financial instruments depend upon defining an appropriate trigger mechanism. So there'll be some discussion around what those triggers are and how they can be structured and governed. We want to make sure that we get the perspective of both donors and recipients in this. And also there is some focus on how do we create incentives for public health preparedness instead of a focus on response alone. So incentives for preparedness will also be a theme that you'll see that cuts across some of the panel sessions. In organizing this workshop, I think the planning committee and many of the members who were consulted also thought that we want to get as much diversity of perspective, both in the panel sessions and also the members who are invited. And so this workshop brings together multilateral agencies, bilateral agencies, private sector banking and financial institutions, many private philanthropic foundations, recipient country governments, country representatives from Norway, UK, US, Mexico, Liberia. I mean, missing a few are here. So that gives us a broad, multidisciplinary, and a range of perspectives to consider. With that, I'm going to invite IOM NAM President Victor Zhao to tell us more about what the Global Health Risk Framework is and how this workshop fits within that. Thank you, Victor.